Probably the most unique thing about WorldClinic is this idea of continuity. Continuity of relationship with the doctor, us, continuity of all the medical information about you, and immediate access so that you could be sick anywhere in the world, and with a phone call or a Skype video conference or a FaceTime video conference, we could see you, we could talk, we could figure out what's going on. You have our medical kit, we can treat you on the spot. That problem doesn't really, the nature of the problem doesn't matter so much as reassuring you've got someone immediately to begin solving the problem. We're able to treat common problems in uncommon places. And by this I mean, a lot of our clients are globetrotters, or they're stationed on a remote island, a ranch, but they're far away from conventional medical care. And a common problem, say, influenza, or shingles, or just a really bad sinus infection, or an infected tooth. That's a common problem. But if you're 1,000 miles from medical care, it begins to border on a crisis. So this is probably the biggest object that differentiates WorldClinic. This is a prescription medical kit that every single one of our patients have. One half of the kit is a prescription pharmacy, and the other half is an over-the-counter comfort medication pharmacy. There's a return on investment for you here to understand what's going on in medicine, because your client does have a most fundamental asset beyond money, homes, houses, and it's their health. If you can play that role of protecting that fundamental asset, you're a better advisor, and that builds a stronger relationship.
And it all started with a rather routine office visit to my doctor at Leahy Clinic. But I mentioned to him that I was leaving in a couple of weeks to go to Beijing. Well, you know, there's a new program that we're offering through Leahy called WorldClinic. And they offer medical support and emergency flybacks for people who have problems on an international basis, for people just like you. So I went back to bed on Sunday night and awakened suddenly with a crushing pain in my chest and radiating down my arm. And I said to myself, I'm having a heart attack. I picked up the phone and called Dan Carlin. It was answered the phone. And I said, Dan, I'm having a problem. He said, get your kit bag out, take a nitroglycerin pill. I did. Take another one. Didn't do any good. And they usually react very, very quickly. And he said, well, take a nitroglycerin patch, put it on your chest, lay back, I got you. From the onset of my heart attack, the pain, all of that, to the point where I have a doctor on the bed and with his nurse giving me an EKG. I have my associate putting my clothes together to go to the hospital. I have the EMTs pounding down the hall to come and get me. I have the hospital alerted that I'm coming. All of that was done in the first 15 minutes after the onset of the heart attack from a bed in Beijing. That's the kind of turnaround of medical support that saves your life. If it had been for WorldClinic, I would be dead. The speed at which they dealt with the problem, the efficacy of the professional contacts, medications and guidance that they gave, and of course the physical support of the doctor bringing me back, were all part of an integrated program that saved my life, no question.